Thank you for having me here today. I really appreciate it. I actually live out here in Washington County, so it's always great to be able to be out here in my backyard, in my community, talking about these issues. I really also appreciate all of you showing up here today, both in person and online, and hanging in there. I know we're all kind of warm and drowsy. I hope you don't fall asleep, but if you do, unlike when I was a teacher at Portland State, I promise not to call on you. I'll just let us. So I'm going to talk a little bit about the Homelessness Research and Action Collaborative. It's a research center. I call it HRAC. It's one of the most unwieldy acronyms we could think of, but we haven't come up with anything better. I'm going to talk a little bit about how we define homelessness and how we estimate homelessness after that. We'll talk about some of the causes and conditions that lead to homelessness and a little bit about solutions. And then I'll address some common myths and stereotypes. So HRAC is a research center. It's fairly new. We started in 2018. Our mission is to address homelessness with a real equity focus, especially a racial equity focus. We're not a service provider. What we're doing is looking at evidence-based best practices, looking at existing research, conducting new research, and we work with nonprofits, city governments, county governments, the state, and the federal government to help address homelessness more effectively. We bring together expertise and skills from across PSU, throughout the region, and across the country. We also work very closely with people experiencing homelessness as co-researchers and on our advisory board, making certain that we have their input in everything we do. I'm going to provide just a few examples of projects that we've done so you can get a good idea about that. We created the first ever regional estimate of homelessness and housing insecurity across the entire Portland Metro, including the cost of different potential solutions. This was in 2019, and that helped inform the supportive housing services measure that Catherine was talking about earlier. How many of you have heard of Portland Street Response? Raise your hand. Okay, great, about half of you. So Portland Street Response is a non-police first response to somebody experiencing homelessness or a mental health crisis. So instead of sending an armed police officer, they send somebody who is a social worker or a mental health professional who has experience dealing with that. And what that does is it frees up the police to deal with crimes or somebody who is, threatening others or themselves. And we've actually seen a pretty decent reduction in fire and police calls for these types of things. This is a model that's been really successful in other cities, especially places like Eugene, and is now being adopted across the country. So we are really happy to help design this program, and we're now running the evaluation of it. We've done a lot of work on tiny home villages, like you see in this picture here. Pods, personal occupancy dwellings, which are a little bit smaller than a tiny home, we call them that. So we've done a lot of design and build of these, and we've done a big evaluation. If you're interested in that, this, along with all of our research, is available on our website for free. One of our projects is in Forest Grove. We're working on an upcoming tiny home village there. We looked at the cost of evictions to the state after the eviction moratorium expired. What is the cost to society of somebody who is evicted? How many of those people end up experiencing homelessness? What are the increased burdens on other services once somebody is evicted from their home? And that helped inform some of the debate and policies coming out of the state legislature. We've looked really closely at what people who are experiencing unsheltered homelessness actually say they need and want. What do they really need to be housed? What kind of services do they need? What would help them feel safe and supported? So we've done a lot of that kind of research as well. We've looked specifically at housing insecurity and evictions for people of color who are renters. We've developed some best practice guides for airports and public transit agencies nationwide on behalf of the federal government for how to effectively and ethically address homelessness in their properties. And right now we are helping coordinate the first ever regional point in time count where Clackamas, Multnomah, and Washington are all doing it the same way at the same time. Catherine talked a little bit about that earlier. I know some of you out here have volunteered or as part of your work have helped conduct the point in time count this week. I just want to say thank you. I know that's an extra lift for you, but we really appreciate everything you're doing. I mentioned Catherine earlier. I'm really glad to follow Catherine and Chad because often when I give this presentation, I get a question. I say, gosh, I'll have to talk to somebody who's coordinating services. Or, well, that's a good question, but I'm really not a lawyer. And so we've got all those questions out of the way already, and I don't have to answer them. So housing and urban development defines homelessness as lacking a fixed, regular, and adequate nighttime residence. For example, living in a shelter, car, or a tent. That's the definition that's used for the point-in-time count. But to make things confusing, the Department of Education uses a different definition that only applies to students, which is the same as the HUD definition, but also includes people who are sharing housing by necessity rather than choice, somebody who's doubled up. And that is a sort of invisible form of homelessness. Often folks who are doubled up, maybe staying somewhere in violation of a lease, so they and the family members or friends they're staying with could get kicked out. They might be forced to live somewhere in larger numbers than is safe for their residents. Living somewhere where the conditions aren't that great for them to stay. So that's a really important aspect of homelessness that we rarely see and talk about, and that we don't effectively measure among adults, just among students. So something to keep in mind is that when we're talking about homelessness, there are actually different definitions from the federal government, and different ways of counting homelessness. So we talked a little bit about the point-in-time count earlier. That's that census that we're doing right now. Service providers also submit annual records of some of their programs and services, the number of people who are using them. Schools conduct a count of students that are believed to be experiencing homelessness. But no single one of these estimates is completely accurate or comprehensive. You really need to look at all of them together to get a good picture and understanding of what homelessness looks like in our communities. In Washington County alone, more than 2,000 K-12 students experienced homelessness in the 2021 to 2022 school year. There were about 18,000 students experiencing homelessness across the state in that school year. And about the same number of people who are experiencing literal homelessness using some of our other accounts. So we're looking at a huge, huge issue. In Washington County, in 2022, about 800 people were experiencing homelessness. About 28% were unsheltered. This is lower than the state average, and as Catherine was showing in her slides, it's a pretty big reduction recently. So again, that shows some pretty exciting progress in terms of getting people housed and providing more shelter space as a result of better coordination, the supportive housing services measure, and other efforts by the county and local cities. So what causes homelessness? You'll hear a lot of definitive one-size-fits-all statements about what causes homelessness on social media. What really causes homelessness is a lack of affordable housing. And here I do want to pause and say that homelessness disproportionately affects people of color, especially Black people and Native Americans, because of systemic and institutional racism in our country. That link is definitively proven. Because of racism in education, housing, employment, healthcare, and the justice system, we see that people of color are more likely to experience homelessness. Other groups who are discriminated against, such as the LGBTQ community, people with physical disabilities, are also more likely to experience homelessness. Again, people experience homelessness because they can't afford housing. There are a lot of reasons somebody may not be able to afford housing, but that is ultimately what pushes somebody into homelessness. And I'm going to talk a little bit about the affordable housing piece in a second. Catherine talked a little bit about the housing first model, which is proven regionally, nationally, and internationally as to be one of the most, if not the most effective and successful approaches to addressing homelessness. That means that you get somebody into housing as soon as possible, and then you worry about the rest. You make certain that they have the supportive services they need. If they need mental health treatment, if they need addiction recovery, job training, employment placement, you make certain that those supports are there when they enter housing, that they can engage with them when they're ready and willing. But you make certain you have the housing first, because it is so much harder to do all that successfully if you're sleeping in a tent, if you're sleeping in your car, or even if you're sleeping in a shelter. So let's talk about the housing crisis in Oregon. There are only 26 available and affordable homes in Oregon for every 100 very low-income rental households. There are 150,000 households in the metro region that pay more than half their income for housing and receive no assistance. Housing choice vouchers, unlike, say, SNAP food stamps, don't go to everybody who needs them. It's dramatically underfunded by the federal government. Only about a quarter of the folks who need housing assistance receive it, typically in Oregon and across the country. So what that means is that you see a lot of people who are paying more than half their income for housing. When somebody is paying more than 50% of their income for housing, they're considered extremely rent burdened and at very high risk of experiencing homelessness. So that is a huge pool of people who could be at the brink of homelessness if they have a job that they lose, if they have a big healthcare bill that comes in that they can't pay, or some other really difficult choice that they have to make. And that's why the prevention side is so critically important, because we can increase the number of people we move out of homelessness every year. But if the number of people who are entering homelessness increases at the same or faster rate, we won't see a change in those numbers. I'm going to talk a little bit about some of these common myths and stereotypes that you hear typically on social media, and what the truth is behind these. You know, like I said, we're a research center, so we're conducting our own studies, surveys. We have surveyed a couple of thousand people experiencing homelessness across the region at this point, I believe. We've looked at other surveys, other research, so I'm pulling from all of this evidence when I'm talking about these things. You'll see some citations in the slides that you'll be able to follow up with later. You can go to our website to learn more, or you can just email me directly. I'll provide my email address if you have more questions. But I want to give you a sense of sort of where this information is coming from that I'm sharing. So 3 of these common myths that you've probably all heard are that people come here for the services, sort of the magnet myth that if we provide services for people experiencing homelessness, people experiencing homelessness will flock here. Another one is that people just need a job and they're not willing to work. And another harmful myth is that everyone experiencing homelessness is suffering from an addiction or severe mental illness. Let's talk about the magnet myth first. So typically, fewer than 20% of people experiencing unsheltered homelessness in a West Coast city came there for the services. This is a number that I've seen for Portland, I've seen it for San Francisco, and it seems to hold true pretty much across the board. What we typically see is that folks experiencing homelessness in a community came there for a job, they came there to live with family and something didn't work out, or they grew up there and they've lived there their whole life. And so I think that's something that's really important to keep in mind is that, you know, if you see somebody experiencing homelessness, it's easy to say, oh, well, they must be from somewhere else. And so it's not our problem. But more often than not, they are from here. There are neighbors, there are community members. And so hopefully you all would want to provide a solution no matter where somebody came from. But this is a bit of a sort of an excuse sometimes. To not commit more services or support. Another one is that folks just need to get a job. You know, maybe they're not willing to work. It's another myth I've heard. National studies I've seen show that more than half of people living in shelter are employed. And about 40% of people experiencing unsheltered homelessness have a job. It's really just that they cannot afford rent. Rent is so expensive right now in the region, as I'm sure you all know. Any of you who are renters or who have rented recently know. And it just continues to go up and up and up. A recent study across the country found that for every $100 increase in rent in a community, they estimated that homelessness would go up 9% based on that. So it's very predictable to see increases in homelessness as rent prices increase. And you see this across the country now in communities that used to brag about not having a homelessness crisis. As their rents have increased in the last couple of years, they're beginning to see the same types of crises that Portland is having and other West Coast cities that have had huge rent increases in the past 20 years have been having. In Hillsborough, so I just looked this up a couple weeks ago, one bedroom rent increased about $250 from 2019 to 2022. So, you know, we're seeing these big rent increases everywhere across Oregon now. This is another really common stereotype, is that everybody experiencing unsheltered homelessness has a substance use disorder or a severe mental illness. So in Portland, a little more than a third of folks experiencing homelessness report a serious mental illness, and about the same number report a substance use disorder. This is pretty similar to the numbers that we see from other cities. However, Oregon has the 5th highest unmet need for mental health services in the country. And I've seen several studies now that show that we have a huge shortage of behavioral health and mental health workers. So this is not the sole cause, but it is a cause, and one that is really, where we really need more supports and services for folks who are dealing with a severe mental illness. Yeah, question back.
So you can say it was, I don't know, you can say 33%, but there's probably an overlap in those numbers.
There is
Some are mentally addicted and also substance. Yeah, substance.
Yeah.
Right. So, because I've always wondered what percentage of these people just are homeless because they're mentally ill, or so do you have that?
You know, it's there is actually a significant overlap. Some folks sort of self-medicate to deal with mental illness. What we also see is that the trauma of homelessness tends to worsen any sort of existing mental health issues that people have. So, you know, if they go with the mental illness, it often gets much, much worse once they begin experiencing homelessness. And it's the same thing with substance use disorders, right? It's hard to untangle cause and effect. It is traumatic experiencing homelessness. And sometimes people turn to substances as a way to sort of address that trauma when they don't have other supports available to them. So you can't say, oh, this is definitely causing their homelessness versus this is a reaction to their homelessness. It's hard to untangle those two. It's a great question though. So that's my very quick overview. I tried to avoid my old sort of lecturer habit of going on really long and boring everybody. But what I want to do is make certain we have plenty of time for you to ask questions and for you to engage around it. There's so much I could have put into this presentation that I didn't. So I want to make certain I'm answering the questions that y'all have.
Right. Hold on a second. Please, round of applause. I just want to make sure we leave the mic around for questions for the sake of our interpreters and for the people listening on Zoom. And just real quick before we get to questions, because I want to make sure this announcement gets made before people start leaving, interpretation is something that you should be expecting from your city from here on out. So please, 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 if you have friends or family that haven't historically or currently engaged because of a language barrier, please, please, please let them know that we will be providing interpretation, and they can reach out to me, the community engagement manager, for any questions about upcoming events, and if there will be interpretation available at those. So, now we get to some questions. I'm going to start with a hand that's raised over here. I saw yours go up first.
So the homelessness and the mental health issues. I think that I have a friend that works a lot with homelessness in Seattle. And she says their greatest success is when they can reconnect someone who's experiencing homelessness with their family that they have made. Also, that the mental health issue is so huge that because we don't have enough services. So my brother-in-law is schizophrenic, and we have been trying to find him. He is homeless in Portland. We've been trying to find him for years. And we, because of the laws and because of Many times when damage was open, he was in damage, then he got out. Then he would occasionally put himself into St. Vincent's. He would be on medication, he'd get stable. Schizophrenics don't believe most of the time that there's anything wrong. So then he would go off his medication. Eventually, the illness got so bad that he would not approach his family. And we cannot find him. And no one in the shelters, nothing, police investigators cannot track him because of the laws. We would love to help him. We would love to seek him out and help him. But it's like a double-edged sword. You can't help him because of the protection. We can't find him because of the protections. It's his choice. We've worked with, the NAM, the NAM. I mean, we've tried many times to find. He's now, my husband is 69 and he's older than my husband. And we have not been able to find him. His mom is 94. We'd like to see her son before, Anyway, I'm sorry, I digress, but it's just, I don't know, how do we legally even, how do we change the mental health, protections? I know they're protections, but.
Yeah, thank you for sharing that. And I'm so sorry to hear that your family's dealing with that. That just sounds terrifying. And I hear a lot of similar stories. It's, as Catherine was saying, this is a systemic issue. You have to think about the housing side and the services side. You have to think about mental health and behavioral health and, healthcare and all these other needs that are being unmet. And we really need to make certain we're addressing all of them in concert to ensure that the people are able to successfully move out of homelessness. And I appreciate you sharing that story.
Okay, we have another question over here, and I'm coming back to you next.
Thank you. Thank you to those who put this on. And I'm so encouraged by seeing so many people here from the community. I think this is just a personal comment. I also want to say I'm really encouraged by this. I'm really optimistic that if there's any city in Oregon that can kind of pave the way for some solutions, I think it's Hillsborough. I also do have a question. I have heard, and I don't know if this is true at all, so I'm curious about, and you kind of talked about this a little bit, but I'm curious about people in other states sending folks here who are experiencing homelessness. I've heard that Idaho sends people here. Is that true?
I have read about some of these programs in other states where if somebody has a family member that they think they can connect with, they'll help, pay for a bus ticket or something there. What I've read is that they're pretty small. We're not talking huge numbers of people. I don't remember the exact numbers, but I do remember reading a few articles and studies on this, and it was not significant numbers at all. And I believe the rationale again is that, if somebody is in Boise connected to services there and they say, oh, I have a family member in Portland, I just can't get there, they might provide them a bus ticket. That's what they're saying. Their goal is anyway.
All right, thank you. We have another question right back here.
Hi, thank you so much. I really admire and respect what you guys do. I have a question about data collection. Obviously, it is very hard to get accurate quantitative data from through these populations just by nature of everything, notwithstanding Department of Education, HUD, everything, personal frustration. But do you find yourself instead turning to qualitative data collection at all? And if so, what kind? I have really high hopes for this year's PIT count. But do you turn to qualitative data at all? And if so, you said surveys, what does that look like? Do you then obviously this is an obnoxiously pretentious question, so I'll stop now.
No, I love this question. That's great. I love the data questions. That's what I do. Yes, we use a lot of qualitative data, and I think we are different than a lot of the reporting requirements, because that's something that we can do. You see a lot of these reporting requirements and it's very quantitative. A lot of this reporting that is required by the federal government is more about how many folks do you have experiencing homelessness? What can you basically tell us about the demographics? And then how many of them are being served and in what way? Essentially, how much money should we give you? What are you spending that money on? And what is it doing? we do a lot of qualitative data gathering. So, we do big surveys and we coordinate surveys like the PIP. We also do lots of other surveys that are asking, very sort of straightforward questions. We do a ton of interviews for all of our projects. And we have a big qualitative element for almost every single one of our research projects. So for Portland Street Response, we're talking to folks experiencing homelessness one at a time. We're talking to service providers. We're talking to people served by their program. We're talking to police officers and firefighters, and first responders. For our villages research, we're talking to people in villages, people who want to go to villages, people who are running villages. And we're often sitting down and doing for every single one of these people, 30 minutes, 45 minutes of conversation. And that's a lot of work and it takes a lot of time, but you learn so much about people's experiences, what's working for them, what isn't, what their aspirations are. And that's a part of the work that really speaks to me. And I think it's so important when you're doing research and gathering data, because this is something that the service providers and outreach workers understand. We're talking about people. We're talking about these numbers. Every single one of these numbers is a person whose life has been fundamentally disrupted in a really awful way. And we need to remember that and remember how challenging that is and remember that every single person out there has a different story. There's no one size fits all solution apart from making certain everybody has housing. And there's no one reason that led everybody to where they are. So yeah, I love that question.
Okay, so just real quick, I had a comment about the database to find access to these services and things like that. And while there isn't necessarily one that the community can just kind of search through, that's what 211 is for, right? To connect with 211, get those services, to get connected with those. I have one question I'm going to read from the Q&A here, and then I have a couple folks back here that I want to get questions from. And I saw a bunch of hands going on the front here. We're trying to get to you all, but we are short on time. So the question from the chat is, how much support does the state give for homeless initiatives? I was shocked to see that Oregon raised their rent cap to 14.6% from 9.9% this year. This is a tremendous increase for people on fixed income, especially if that trend continues in cities where there is no local rent control.
I would have to look at the legislative budget to see the exact numbers. I do know, and I'm looking here at you online. I'm making eye contact, I can't see you. I do know that, just in the last few years, the legislature has invested a lot more money in addressing homelessness. And I know that Governor Kotek has talked about increasing that amount more. So I think we're seeing a much bigger commitment in terms of dollars to make certain that we're expanding services to actually meet the need. And Catherine was talking about what we've seen across the metro region and also Washington County, again, making certain that we're spending more money to make certain that we're really providing more of these essential services and supports. In terms of the rent cap, and, as I've talked about here, the more the rent goes up, the more people will experience homelessness. So, that's how it is. So we'll have to figure out some way to make certain that we're preventing those folks from slipping into homelessness or moving them out as quickly as we can if they are.
Just want to acknowledge you're a seasoned vet and looking at the mic answering that question or the camera. All right, I have a question here from the audience.
I guess in terms of, since you're saying a lot of it is like on the legislative level, from your experience, do you feel like the anyone that in legislature that you have been able to speak with is receptive to the kinds of studies that you do, or do you feel, is there a way that you measure the effectiveness of the studies that you do on laws that can be passed?
Yeah, we do. We work to make certain that we're working as close as we can with the governor's office, the legislature, and state agencies to keep them updated on new research. We do a lot of research projects for them. We do briefings whenever requested. Sometimes we come and give testimony when the legislature's in session, talking about certain research findings or people have a question. So that sort of policy education piece is really important, just like our public education piece. We want to make certain that all of our elected officials understand the research and what's working, what's not, and that the public understands those same things so they can make informed decisions when they're voting or engaging in public discussion.
We got here a bit late, so sorry if this has already been addressed, but do you have any sort of estimate on how many people experiencing homelessness are immigrant or non-English speaking individuals?
It's pretty low, but that's just for literal homelessness. So the pig count that we're talking about, where folks are in shelters or living on the street and are actually counted by that system. You know, I've seen the numbers for Portland, which has asked a detailed question about sort of where you're from originally in the past. And I know that's pretty low. I don't know if that is accurate or not. You know, like Catherine was saying, we know the pig count is an undercount. So when we're getting that kind of information from the pig count, we can probably be sure that we're missing some people. We just don't always know which people we're missing. So I'm afraid I don't have a number at hand to share with you.
All right, before we get to our next question, I just want to acknowledge a couple of things that Mandy put into the chat. As a reminder, we will post today's PowerPoints on our homelessness initiative page next week. In addition, we have a monthly homelessness e-newsletter as one way to stay up to date with projects and initiatives as they move forward. You can also sign up for this newsletter directly on the homelessness initiatives page.
I have a question. It could be a dumb question. English is my third language. So if I don't say it right in English, you would understand me. Could it be somebody from another country one time told me, and I don't remember where she is, and she said, could it be, is it possible that the system in the US encourages homelessness? And I would also explain an example that I have had. At one time, I was with sales, and I asked someone who didn't have a house, don't leave a house. And I said, if you work with me, I will be able to help you financially and help you support yourself. And the response was, if I work, I don't get the support I get from the government.
A lot of people who are experiencing unsheltered homelessness, from what I've seen, aren't receiving a lot of supports from the government. And, you know, I have heard about the issues around when you're right around the threshold in terms of your earnings, where you're, you know, there's sort of a benefits cliff. And I have heard about attempts to adjust that. So instead of saying, okay, if you earn more than a certain amount, you lose this benefit or you lose that benefit, saying, okay, well, it generally tapers off. So you're not seeing a huge change in your quality of life. I can't speak to those policies in other countries. I don't know enough about them in other countries. But I wouldn't say, you know, I think that if that has any effect, it's probably pretty small and really on the margins of what we're seeing in terms of people experiencing homelessness and the actual numbers of folks and the reasons why.
All right, thank you. I was just conferring with our interpreters because we're about 5 minutes from the stop, and one of them is going to stay a little bit extra for some extra questions that we have. And so our next question here.
Thank you. I've been in HR for many, many years, and quantitative analysis is the highest management skill that one can apply for policy making. So I really appreciate you inviting this gentleman, because going back to the question the young lady just said, I work in the Latino community. And so our statistics look something like this: 55,000 average annual income. Department of Labor says Latinos are at 38,000 a year. Not the ones that I work with here in Hillsborough, they're close to 28,000 a year. In order to afford a 2-bedroom apartment here in Hillsborough, you gotta be looking at 40,000 a year. So if they're not homeless now, they will be, except for a cultural value that we treasure. As long as you've heard, mi casa es su casa, my home is your home. As long as I have the roof, so do you. So we have a different value system of how we work with our homeless people. The other criticism you hear in our community, 2 or 3 families are renting in one apartment. Well, that's the only way we can afford it. So I share that with you in terms of statistics that tell the story. Thank you, sir.
Yeah, I mean, when people are double up, it's hidden, right? You're not getting counted. the number of people who are experiencing homelessness, especially when adults are doubled up and they're forced to double up because they can't afford rent. They're just not showing up in those numbers that we see.
That's right. Thank you.
All right, so again, just a quick time check. It is 3:14 by my clock, so I wanted to make sure we give a round of applause to our presenter here. And the rest of our presenters as well. I know there are still questions, if our presenters are able to stay and answer a little bit for a couple minutes still. Okay, feel free to ask a question to any of the presenters, and we'll have this going on for like 5 more minutes or so, because we do have to stick to time. Yeah, and all get flexible.
So this question was for the last presenter. I was wondering if the HRAC has done any research on size and scale of shelters, supported housing, and how they are best incorporated into existing communities. So perhaps looking at the population of the community and what it can support and embrace.
So we haven't, there was a big shelter study that's done by a nonprofit a couple of years ago, I think it was 2019 across Oregon. And it showed that there was about enough shelter beds at that time for roughly half of the people experiencing homelessness in Oregon. We haven't looked specifically at HRAC, at shelter availability or siting since then. We are doing some interesting projects right now looking at motel conversions, which have shown some pretty positive results when compared to these traditional mass shelters, these congregate shelters are the old model. And motel conversions tend to be a faster way to provide shelter space in a community. So that's a really exciting new model that came out of the pandemic. So we haven't done any, we don't have any findings to share, but we do have some interesting work going on looking at different types of shelter and what's working and what's not.
Yes, my question is more directed from a community perspective. More directed from a community perspective, I think one of the biggest barriers is acceptance by the community, because communities can feel overburdened if you have a number of shelters opening up in close proximity to each other. I know because of fair housing, it can't be regulated, but is there a best practices of not overburdening one area or the other,
Well,
so that the people can be supported?
I'll give you my highly controversial opinion, which is that we should place shelters as we should integrate housing. That's the best practice, it's proven best practice. And then we're citing shelters. We should not cite shelters only in low-income neighborhoods or industrial areas, and make sure that they're spread throughout the community, meeting people's needs wherever they are and as close to services as possible, rather than saying we're only going to build shelters in certain areas, which some cities around the country have tried to do. So I think we do need to make certain that all of us, all of our neighborhoods and communities are pulling together and are supporting effective solutions to homelessness and effective pathways out of homelessness.
All right, thank you all. We are going to officially close the meeting now.